Hello everyone, I'm here again, Dr. Mrs. Unubra Balade, medical doctor and microbiologist. I'm here to talk to us about the cholera outbreak in Nigeria. I wonder if some of us are aware. I know that because of the COVID pandemic, it appears that other infectious diseases have taken the backstage. However, according to the Nigerian Center for Disease Control website, as at June 21st, 2021, and I quote them, it says, since the beginning of the year, 10,833 suspected cholera cases have been reported. 112 of these cases have been confirmed, and there have been 289 deaths in 2021 so far. I further quote them. It says, in the last 1 month, an increasing number of cholera cases have been reported across states. The most affected states are Plateau, Bauchi, Gombe, Kano, Zamfara, Bayelsa, and Kaduna. Okay, so, some of us would say there has always been cholera in Nigeria. However, by the definition of an outbreak is the occurrence of a disease in excess of what is normally experienced in a location. So what is cholera? Cholera is a preventable and a treatable epidemic-prone disease which is transmitted by eating or drinking contaminated food or water. The causative organism is Vibrio cholera or Vibrio coma, as some of us say it casually, because it is a coma-shaped organism. It is a gram-negative, rod-shaped organism that has a flagella. That's why we call it a coma-shaped organism. And it produces a toxin that causes the body to secrete enormous amounts of water, body fluid, so to speak, leading to diarrhea and a rapid loss of fluid and electrolytes. So what are some of the symptoms of cholera? Diarrhea, of course, that's the first thing that comes to mind, and it's usually profuse. It may quickly reach up to about 1 liter in an hour, and we commonly call it a rice water stool. Okay, so there's a picture of it. You see, we say it's rice water stool because it has this pale, milky appearance that resembles water in which rice has been rinsed. You know, when you rinse your rice before you boil it, that's milky appearance. Yeah, so it's called the rice water stool. Another symptom is nausea and vomiting. Okay, so vomiting usually occurs in the early stages of cholera and can last for hours. So you just imagine the person is losing fluids through the mouth, he's losing fluids through feces. Okay, so the person is losing a lot of fluids, and this can lead to the third symptom called dehydration. Of course, not everybody will know what dehydration is, but there's some symptoms that can be picked up. So dehydration may develop within hours after cholera symptoms, so that is after the symptoms of vomiting and diarrhea, which will lead to dehydration. So what are some of these symptoms of dehydration that people can pick? You may have things like irritability, especially amongst children. They are just irritable, they can't sleep, and then they may be very tired, lethargic. They may have sunken eyes, they may have dry mouth, extreme thirst, or their urine output is very little, they hardly urinate. If it goes on for a long time, there may be complications. It can lead to complications such as shock, kidney failure, and even death. The risk of death from cholera is actually higher when treatment is delayed, even though cholera is treatable with some antibiotics at the hospital. Therefore, it is very important to visit a health facility if you have symptoms such as watery diarrhea and vomiting, especially when they are not relenting. The risk of death is especially increased in children. So in the event of any of these suspected symptoms, I have put a picture of what the stool looks like, the rice water stool. It may be helpful initially if in the middle of the night it happens, or you are not able to reach a health facility immediately. It may be helpful to give the child oral rehydration salt, which can be bought over the counter, in the process of seeking proper medical care. So what are some of the causes of cholera outbreaks? Okay, so surface or well water, so contaminated public wells, and that is why it seems to be as if during the rainy seasons there are increased cases of cholera disease. Okay, so that's what we call an outbreak. Okay, because during the rainy season there may be surface runoffs, public wells that are that are not well covered can easily get contaminated. Then it could also be spread through raw fruits and vegetables. So in developing countries like ours, uncomposted manure, we're talking about maybe manure that is created from feces that has not been composted and gone through the proper process of preparing it as a manure, or irrigation water that is used to water the plants, that may even contain raw sewage, can contaminate the produce in the field. And these things, come to us as raw fruits and vegetables. And then of course we have grains like the rice, and millets, which can be contaminated after cooking and are kept at room temperature for several hours. So of course during the food handling process, so in the food chain, the process through which the food gets across from the farm to the table, there are different stages by which and processes by which this contamination can occur. So for this reason, the Nigerian Center for Disease Control urges members of the public to be aware of the risk of this disease and adhere to the precautions. I know some of us may say, I don't live in the northern states, but we must also be very aware that anyone is vulnerable, and remember that some of our fruits and vegetables come from some of these places. So we are encouraged to boil and store our water in clean and safe containers before drinking. We're encouraged to prepare, cook, and store our foods safely. Remember, apart from the cooking, the storage, the handling as well, there may be contamination, even from food vendors, and all of that, because it is often shared in the feces, sometimes even the vomitus. Okay, so we are encouraged to wash our hands frequently. I know because of the COVID pandemic, hopefully some of us have been washing our hands, okay, but we're encouraged to wash it especially more with soap under running water to prevent infectious diseases including cholera, especially after defecation and before handling food or eating. Avoid open defecation and indiscriminate refuse dumping, which I already explained as some of the ways, surface runoffs and fecal contamination around surface waters. So, and then people are encouraged to visit health facilities immediately they have symptoms suggestive of watery diarrhea. Healthcare workers, of course, are encouraged to have a high index of suspicion, especially during this time and within these locations. So the NCDC continues to advocate access to clean water. It's important to know also for expatriates or people who are coming from the United States to places that are prone to cholera, that there is a vaccine called the Vaxchora. On this note, I want to encourage us to continue to stay safe and stay healthy. Cholera is treatable, and let's take precautions. Thank you.